Yes, so that study was actually a case series at our institution, and it essentially was trying to highlight a phenomenon in the literature where MSI-H colon cancer after curative intent surgery, right now for stage 3 colon cancer that is resected, even if it's MSI-H or defective mismatch repair, the consensus guidelines still recommend oxaliplatin-based chemotherapy. However, we recognize that in other tumor types and even in rectal cancer, for example, in earlier stages of colon cancer, standard conventional chemotherapy may not be beneficial in these patients. And what we did is in this case series, we actually used ctDNA to monitor the response or clearance of minimal residual disease in these patients using consensus-based oxaliplatin-based chemotherapy. In these cases, what we saw was that oxaliplatin-based chemotherapy in MSI-H resected colon cancer in the adjuvant setting did not clear ctDNA. Instead, ctDNA persisted. And with that knowledge, we know that recurrence or metastases is virtually inevitable in over 90% of the time if you don't act on this within a certain time frame. So we were faced with a tough decision, knowing that MSI-H in metastatic settings respond really well to immunotherapy. Do we continue our oxaliplatin-based chemo despite the knowledge that ctDNA is rising and these patients may be relapsing inevitably? Or do we switch gears and try immunotherapy in these patients? We went with immunotherapy and we saw an immediate clearance in ctDNA, and both these cases remain in remission, no radiographic cancer detected, ctDNA is clear. They're off the immunotherapy now and on surveillance. And I think this is highlighting an important point that despite consensus recommendations that everybody should be getting standard chemotherapy in MSI-H colon cancer stage 3, not all patients will benefit, and these patients may be better suited with adjuvant immunotherapy, where ongoing clinical trials are trying to answer this question and make it a standard, but ctDNA in this instance offered a window of opportunity to protect these patients and their long-term futures.